China opens its border, also treating COVID as type B disease. What does that mean?
I think this is a very important turning point. People's life and work, study, all these things need to go back to the normal. And I think people will support that policy change and also will, use their own action to support that change.
Yeah, so I agree with most of the 10-point plan. I think it is a well thought out plan. We need to shoot for that WHO goal of 100% vaccination among the most vulnerable groups. Make sure that you protect your healthcare workers, because once you have your healthcare workers get sick, then who's going to take care of your COVID patients, right? There's still people who are on the fence. They're hesitant about getting vaccinated. And so the first step is to listen to why they are hesitant, convince them that they need to get vaccinated, because we know even though there has been a change in virulence, vaccination has cut the risk of developing severe disease and death in inpatients and people who are hospitalized by half. This is for all the variants throughout the pandemic.
From the point of view of the care, we know way more than what we knew 2 years ago. I feel the antiviral treatments and the care management of the most difficult patients have been improved a lot. So hospital and medical doctors know way better how to handle those patients. And I think China is really prepared to take this next step and open to the wall and basically catch up this herd immunity that the population needs.
I think as far as what China can learn from other countries is the experience that a number of countries had with community-based infusion centers or treatment centers, and also the concept of diagnose and treat for high-risk patients. This was used in the US, where if someone was diagnosed with COVID, even if they maybe had mild symptoms or didn't have symptoms at all, they would immediately receive antivirals. So I thought that was a very good program, and one that China could use as well.
I believe everyone should have a plan. The chances are high you're going to get COVID. So have a plan. If you have symptoms or you've been told that you are a close contact, what do you need to do next? Who do you call? Where do you go for medications? And then who's taking care of mom? Who's taking care of grandmother? Who's taking care of your elderly uncle? Make sure that the community has a plan for protecting the most vulnerable members of your family and your group. We don't want to leave anyone behind. We all need to get safely to the other side.